Hello. I'm urologist Akkaya. Today we are going to talk about when sperms recover after using anabolic, when spermiogram parameters recover. As we all know, when testosterone is taken from the outside, or anabolic substances. Gonadotropins such as FSH, LH, namely sex hormones, decrease. And since the testosterone level goes down too, the quality of the sperm starts to deteriorate after a certain period of time. A lot of fellas told me that they had their wives pregnant while on cure. Of course, they can get their wives pregnant while on cure because the deterioration of these FSH-LH levels and sperm parameters doesn't happen all of a sudden, because producing of sperm takes approximately 75 days. Which means, your damaged sperms can be observed in the semen 2 or 3 months after the use. In other words, if you gave sperm analysis in the first month, a change barely could be seen. If we check a study where testosterone enanthate was used for 16 weeks, almost 4 months, we can see that, after the end of 4th month 40% of those normal people happen to have azoospermia. Azoospermia means having no sperm in the semen, total infertility. The rest has oligospermia where a decrease in sperm parameters and concentration was observed. The problem here is that, when testosterone is taken, the FSH and LH values go down and they start to come to the previous level 3 to 4 months after the intake ends. If the consumer doesn't have a PCT, it comes back to normal after 3 to 4 months, and after those FSH and LH levels become normal, they need to be kept like that for at least 3 or 4 months so that sperm parameters can come back to normal. Which is around 6 to 8 months of period. In other words, after a 6 to 8 month period after quitting the anabolic, the sperm count can be around normal. One of the most asked questions is, will I be completely infertile if I use anabolic? This is very rare. There are examples who used anabolic for 5 to 10 years, in a high dose. This is like, for example, a patient uses anabolic for a year. This is like putting your arm in a plaster cast for a year. What happens when you take the plaster cast off? The arm muscles would be totally atrophied, the joints would be calcified. In order to have this arm move again, physical medicine and rehabilitation is necessary. And as the period inside the plaster cast gets longer, having functions of that arm back gets harder. This is what happens also for the testis. If you take anabolic for a year, the testicles won't work for a year, and reactivating it, having its functions back takes time. And there are people who use them for years, who use for 5 to 10 years. What happens in that period? There can be so many problems like fibrosis in the testicle and degeneration in testis tissue. But having a few cures, using anabolic once or twice doesn't affect that easily. Also, one of the most important thing is, I haven't seen anyone so far who has sperm analysis or counting or who thinks, would my sperms get affected after using anabolic? Before use of anabolic. You may ask why this is even important. Maybe you already have a disorder in your sperms and you'll make it worse by using anabolic. Because infertility is not related to whether the hormone levels, weight, height, muscle strength, sex hormones of a person are normal or not. The patient may be completely normal with everything, with blood tests and body structure, but still be completely infertile. And we have no chance to know it before having a sperm analysis. The problem with the cases in the literature is here. Because, for example, it's said that someone became infertile after the use of anabolic, but the previous condition of the patient wasn't known, he had no sperm analysis, maybe he was already infertile or not, we don't know. That's the situation. To summarize, after 6 to 8 months of period after the use of anabolic, the sperms can be back to be normal. But like I said, in long period or high dose use, having back testis functions can be harder. Also, as in the examples we have in the literature, infertility is possible. Since we don't know the situation of the patient before use of anabolic. The other thing is that, globally there is a decrease in testosterone levels in males. and a significant increase in males' infertility in the last 100 years due to industrialization and modern lifestyle. You must be very careful before using anabolic. Thank you for listening, best regards.